Good evening, everyone, and good morning to our guests from the other side of the continent. It is my honor to welcome you to the distinguished Professor Rajani Prasanna Endowment Lecture Series. I would like to thank our Chief Patron, Sri D.A. Prasanna Sir, and Professor Rajani Prasanna, art historian and philanthropist, for their endowment work in the area of climate change and public health. In this session of the second series, we focus on a theme that lies at the crossroads of our most prestigious global challenges: climate change and public health, with governance and policy. The intersection of climate change and public health is no longer a topic of future concern. It's one that's demanding immediate evidence based action. As we gather here, it's important to recognize that climate related health impacts are already palpable and profound. According to WHO, climate change is projected to cause approximately 250,000 additional deaths, that is 250,000 additional deaths per year between the year 2030 to 2050 from malnutrition, malaria, diarrhea, and heat stress. These are not just numbers, they represent a serious and rising burden on health systems and human lives. Climate-related health risks are unevenly distributed, disproportionately affecting vulnerable populations, particularly in low-income regions. Governance and policy frameworks play an essential role in bridging this gap by fostering adaptations and resilience in these communities. Studies from the Lancet Countdown on Health and Climate Change highlights the urgent need for policy reforms. Findings show that only half of the world's countries currently have a national adaptation plan that addresses climate and health issues specifically. This reveals a major gap in the governance structure that could mitigate health risks at scale. Today, our moderator and speakers will explore how policy initiatives from local to global levels are being designed and implemented to respond to these health risks. They will also examine how collaboratively governance models can integrate climate action across sectors to foster a more resilient and equitable future. This lecture series serves not only as a forum for dialogue, but also as a foundation for building informed actionable policies that addresses the urgency of climate-linked health impacts. Let's listen, learn, and commit to advancing the policies and partnership needed to safeguard both public health and our planet. Thank you all, and welcome again to the Professor Rajani Prasanna Endowment Lecture Series. I would now like to introduce you to the moderator of today's session, Dr. Neethi Rao. Dr. Neethi Rao is a health policy and systems researcher with an interest in health systems governance and intersectoral public policy at the intersection of environment and health. Her research and practice have involved providing technical support in strategic planning, policy design, implementation, and evaluation, including impact assessments for governments and international development agencies. Dr. Neethi Rao has worked with health systems governance teams at the WHO, supporting research and advocacy towards a World Health Assembly resolution proposal on social partnership for 2024. She is currently a fellow at the Center for Social and Economic Progress, New Delhi, and an adjunct faculty at the Institution of Public Health, Bengaluru. Dr. Neethi Rao is also one of the editors of the Climate Change and Public Health, Governance and Challenges book, which is the first book to be printed under the Professor Rajani Prasanna Endowment Lecture Series on climate change and public health. I'd like to welcome all of you and thank you all.
Thank you very much, Rahul, and thank you to Manipal University and the Prasanna School of Public Health for organizing this lecture series. As you said, this is an important conversation and a very timely one to be had, particularly in our country. And of course, today we have very exciting speakers going to talk about what, to my mind at least, is one of the central questions around climate change and health, which is around governance. Uh, I think we have today with us Dr. Bhargav Krishna and Dr. Vijay Kumar Chattu, both of whom will examine this issue from their own perspectives and use examples from their work to illustrate why and how this is important. And I'm looking forward to the conversation that will follow the lectures. Our first speaker today will be Dr. Bhargav Krishna. Uh, Dr. Krishna is currently the convener and coordinator of the Environmental Governance and Policy Vertical at the Sustainable Futures Collaborative. His research interests span areas on health policy, environmental epidemiology, with a focus on the impact of air quality and climate change on health. Before this, Bhargav was a fellow at the Center for Policy Research in Delhi and had also helped set up and manage the Center for Environmental Health at the Public Health Foundation of India, Delhi. And here he led work related to air quality, climate, and health. In this capacity, he also served on several union and state government expert committees on air pollution, a topic that's again become extremely important and topical, but also on biomedical waste and critically polluted areas. He's also carried out work on health systems and sustainable development across several states of India, which is, of course, important given that health is a state subject in India. Bhargav holds a doctorate in public health from the illustrious Harvard T.H. Chan School of Public Health. He also has a master's degree in global environmental change from King's College London and an undergraduate degree in biotechnology from Anna University, Chennai. He's also currently an adjunct faculty member at PHFI. And today he's going to deliver his talk on governance for climate and health in India. Over to you, Bhargav.
Thank you so much, Neethi, for the kind introduction, and Rahul for organizing this and inviting me to speak at this illustrious forum. So as Neethi mentioned, I'm going to be speaking about governance for climate and health in India. But to spare everybody a long history lesson as well as sort of many digressions, we'll be viewing governance for climate and health in India today through the lens of heat and heat waves and heat action plans and other related aspects, as a useful exercise to try and see how this would play out in other scenarios as well. So let's begin by setting the context a little bit on how climate impacts are manifesting in India right now. Over the last several months, we would all have seen headlines related to the heat waves that have been ongoing in different parts of the country, unprecedented in the number of days and intensity. This is not the first year that we've seen extreme heat. We've been seeing this every year for the last few years, and there have been significant heat wave events in both 2010 and 2015 as well in history. Estimated numbers of deaths range around 100, although these are deaths that are essentially classified primarily due to heat stroke. And there's questions around whether we know exactly how many people are dying because of heat, because of the stringency by which we have categorized what is and isn't a heat death, as well as the challenges in actually counting heat-related mortality across different parts of the country, especially in rural India. And so essentially what we have right now is a scenario where we are likely undercounting the true scale of impacts associated with heat. For a variety of reasons, including the fact that our stringency of criteria may be particularly harsh, bringing individuals to a health facility to be able to be appropriately identified as a heat death continues to be a challenge, and retrospective reclassification happens as well. So, given that, there is a sort of question mark around what is actually the impact of heat waves. And so these are results from a study that colleagues from a number of institutions, including Harvard, Karolinska, Ashoka University, elsewhere, and I published earlier this year in February, where we were essentially trying to understand how many people are dying from heat waves across 10 cities in the country. So this was a number of cities, including Delhi, Mumbai, Kolkata, Chennai, Bangalore, Pune, and others, essentially representing a variety of different agroclimatic zones across the country, meaning people experiencing very different kinds of heat. So heat that is dry heat, potentially sort of high humid heat as well, to try and understand what the profile of heat-related mortality is across the country. And what we learned from this is based on the current Indian classification of what a heat wave is, which is temperatures that are crossing the 97th percentile for 2 consecutive days. There are roughly 1,100 people dying every year across these 10 cities alone because of heat waves. And this is data from sort of 2005 to 2020 across a lot of these cities. But what we also learned, if you can see on the chart on the right, is by varying the definition of how we classify what a heat wave is, we're actually seeing substantially different mortality. Previously, we were looking at 99th percentile temperatures that have been changed to 97th. And more likely going forward is that we'll have to look at the right side portion of this chart, which is essentially looking at 95th percentile temperature. Because if we change our definition of what a heat wave is, we're actually seeing a substantially higher number of deaths than have been previously counted. I mean, if you look at the newspaper report from the previous slide, we're talking about 100 deaths. That's across the whole country. This is across 10 cities, and we're looking at, on average, at least 1,100 deaths every year just from heat waves. So 10 times as many deaths. Likely 20 times as many if we change our definition of what a heat wave is. So there's substantial concern around the actual numbers of people that are dying and potentially also being impacted in other ways through impacts on morbidity, which we really don't have any track of. But challenges also remain in how we unpack some of this data in terms of vulnerability. Because mortality is a sort of crude estimate, we don't really have an understanding of how different communities, especially those comprising outdoor workers, gig workers, people who are exposed to heat on an ongoing basis throughout the course of the day because of their work profile, how are they affected by heat? I think that granularity of data isn't really available for us to be able to effectively answer that question at this point in time. Now, going forward, what we're seeing is that under various climate projection scenarios, this is likely to get substantially worse. So on the right, this is a chart that's prepared by colleagues of mine, as well as collaborators from Harvard and Berkeley, where we're essentially looking at under the 1.5 degree climate projection scenario, which is essentially what was agreed to under the Paris Climate Accords. What would be the increase in heat index across different parts of the country? And heat index represents effectively a combination of heat and humidity, temperature and humidity, meaning the apparent temperature. What is it that you actually feel on your body as a result of both the temperature and humidity in the air? And what we see from just existing commitments that have already been made globally is that parts of Rajasthan, Punjab, Delhi, Western UP, most of Gujarat, and some small sections of Tamil Nadu and Karnataka are likely to witness a 17.5 to 20% increase in heat index above the historical norm for these areas. And this is at the sort of best case scenario projection. This is substantially worse if we look at it at more realistic projections of where we are likely to head with current energy commitments, as well as projections of where we are in terms of a business as usual scenario, which is 2.5 degrees from prehistoric temperatures. And so you can see that this is likely to get much worse, especially in states which also have potential deficits in human development and are already home to large populations which are vulnerable through various other means, marginalized, potentially low in nutrition status, low in health status, and are adding a layer of vulnerability through the exposure to heat that they're going to suffer from going forward. Now, moving to the governance aspect of this, if we look at this scenario, we have so many thousands of deaths occurring every year. You have increased vulnerability going forward. You have barely any information on who is vulnerable and how vulnerable are they and how do we effectively protect them. What is the response? What should responses look like for this from the perspective of the Indian state? So before we get to that, some first principles that we need to set out when we're talking about adaptation and especially climate adaptation, which is, so first is that any future development that the Indian state envisions will really hinge on channeling any growth, economic growth through low carbon development pathways. So while we may debate questions of north-south equity and whether India really needs to take the right kinds of steps with respect to reducing its carbon intensity and carbon emissions down the road, the reality is that any future growth globally, and this is probably more relevant for India, given that we still have a lot of infrastructure and energy needs that are going to be sort of in the pipeline over the next 30 years, we have the opportunity to change the pathway that we grow through going forward. The second is that current climate commitments mean that development will also deeply hinge on how we are able to effectively adapt to ongoing as well as future climate impacts. What I showed earlier was 1.5 degrees. We are already poised to breach 2 degrees globally, which means that mitigation will have to be teamed with adaptation in simultaneous fashion to be able to effectively address the concerns of climate change. The third is that we strongly believe, and this is an institutional as well as an individual perspective, is that facilitating this kind of transition at scale in a nation as complex as India will require really systemic transformations to be able to achieve this. We're talking about rapid changes to our energy mix. We're talking about substantially ramping up health infrastructure. We're talking about decentralizing action for adaptation. Lots of these things require the state to be able to helm it, and helming it also requires systemic shifts in how we're addressing these issues. And finally, this is something that I mentioned already, which is that systemic transformations can only really happen through state interventions. We can rely on the private sector for sectoral actions, but the cohesive framework that is provided for these systemic transformations can only be brought forward by the state. And by the state, I mean the union and state governments, facilitated by appropriate governance structures, whether that be knowledge institutions created for climate or a framework climate law that embeds climate across all aspects of our society. And so the next aspect of this is, what do we actually mean when we talk about governance? Governance can mean a range of different things. Governance can mean the sort of legal framework that we're talking about, it could be the institutional framework. And in this case, what we are talking about when we're talking about governance is a set of baseline institutional structures and policy models that can effectively channel environmental and energy policy as a vehicle for social progress. So choices that we make on environmental and energy progress have deep impacts on human development. So for instance, electrification is a huge priority for India right now, and rightly so. And the choice of how we choose to electrify has deep impacts on the environmental front. A rapid increase in thermal power means air pollution risks associated with that, which means health impacts associated with that down the road, as well as carbon emissions associated with it. Channeling the energy as well as finance the right way means we have a vehicle for social progress that also meets potential climate goals. The second is that we need to make public finance really deliver on both of these conjoined goals of environment and climate. Right now, infrastructure lock-in is a real issue. How do we plan for most of the infrastructure that India needs by 2050 hasn't even started right now. We haven't even built that infrastructure right now. And the choices that we make right now in terms of how we invest money to build out all of those things mean that we have the opportunity to make systemic transformations. And lastly, India has a rich legal and institutional framework which promotes decentralization and localized decision making. And this is through the 73rd and 74th Amendment, which gives local governments as well as Panchayati Raj institutions substantial latitude to be able to make decisions that are consonant with local needs. The second is that building a governance framework around climate and health especially will require three things, three enabling aspects, let's say. The first is that we need to substantially augment subnational capacities. So we may have national institutions that are somewhat capable. So we may have an IMD or a similar institution that has technical capacity to be able to deliver information at a national level. We need to replicate that kind of capacity at a state and local level to be able to address some of these concerns. Similarly, with an operational capacity, and we'll come to this when we're talking about the operationalization of heat action plans. The second is there's a need to create a layer of coordinating institutions that also serve as knowledge hubs. Right now, what we see, whether within the health sector or elsewhere, is that we have lots of wish lists of things that we would like done across other sectors, but very little coordination that actually ensures that that does happen. And finally, reworking of the fiscal architecture to finance common goals across both social welfare and climate. Imagine, for instance, a NREGA that embeds climate goals within it to create blue-green infrastructure in rural areas, consonant with needs of heat resilience as well as drought resilience and various other issues. These are the kinds of alignments that we're thinking of. Where is health and development in this context? We've talked about governance as a whole, and the health system has chosen to respond to it in a particular way right now, but that response has been largely limited. And the reality is that the climate action architecture right now functions very much in parallel to programs on health and development. You have state action plans on climate change, which lay out a list of goals and don't really do any of the hard work of integrating these goals across the various sectors that need to facilitate action. So an environment department at a state level lays out a state action plan on climate change, which has specific goals and targets set for an energy department or power department. Nobody ever talks to each other to try and facilitate that. Health is rarely mentioned, if at all, except as a sort of normative goal that we must do things to protect health. There is no intersection or integration with health sector programs. Imagine closer integration, for instance, with the National Health Mission. That would be a substantial benefit across both goals. And health sector interventions are in isolation. They are laudable, but health needs a really sort of much greater emphasis across the board. So the health sector has taken steps, for instance, to create a national program on climate change and human health through the National Center for Disease Control. Now, this program is largely there to help facilitate states to identify potential risk factors for climate and health in their particular geographical context. And that's largely it. There's some training programs for state level health officials, as well as potentially for ASHA workers down the road. But really beyond that, this is sort of an awareness generation exercise at this point, not necessarily something that is operationalizing anything meaningful, except for most recently what they announced, which is increasing surveillance for climate and health related impacts. Now, structural transformation that we talked about earlier will really only begin when we identify the upstream levers that, when activated, can drive localized planning and implementation, unlock financing from existing and new streams. So, for instance, central sector schemes as well as finance commission money that goes to urban local bodies, and diffuse solutions that are contextual to local needs as well as agroecology. Now, all of these feature in some way in what I'm going to talk about next, which is how the state has responded traditionally to heat waves. So this is images from a study that my colleagues Aditya Pillai and Tamanna Dalal published in 2023, which is on an analysis of heat action plans, 37 heat action plans from states, districts, and cities across the country. Now, there are supposed to be, the rumor to be across at least 150 heat action plans. These are the only ones that we were able to get access to through either speaking with state disaster management authorities or through filing RTIs or other means. Now, analysis of these plans really revealed a few things. One is that most are really not localized in terms of the needs for heat and heat thresholds in those particular regions. There is really poor understanding of what vulnerability is with respect to heat. So, for instance, they use a generic understanding of vulnerability, which means old people, children, pregnant women, potentially outdoor workers, and that's pretty much it. Nothing really understanding the local population composition. Are there particular pockets within your state or district or city that are potentially more vulnerable than others? How do you look at vulnerability through the use of GIS tools? None of those things really go into this. There is no periodic review mechanism, and really HAPs haven't really talked in any meaningful way about financing any of the laundry list of solutions that they've laid out. So if we look at the numbers, only 2 out of the 37 have even used long-term, medium or long-term heat projections to try and understand what are the long-term solutions that need to be laid out. And if I'm not mistaken, one of them was Kerala. And only 2 out of 37 conducted any kind of vulnerability assessments. Those, I think, more recent HAPs that are coming in. So, for instance, HAPs that have been laid out in Jodhpur as well as in Thane are conducting explicit vulnerability assessments. They are including local outdoor workers and marginalized populations in decision making around the development of these plans. But as of the time that the study was conducted, very few had ever done any of these things. And there's some fundamental issues around this from the perspective of democratizing the understanding and implementations of the plan is that, one, they lack any kind of legal grounding. Heat isn't a notified disaster in the same way that droughts or floods are. In some states have gone on in the last year to declare heat a notified disaster, without which you don't have the ability to access disaster response funds either, and really insufficient consultation and evaluation across the board in the development of these. Now, the recommendations from this analysis were many in number, but I'll focus on a few of these. The first is that there was a need to clarify means of funding various HAP solutions that have been laid out across all of these heat action plans. The second is that there's a necessity to clarify the legal foundations on which these are implemented. If there are no legal foundations to a set of solutions that you have laid out and a plan that you have envisioned, what is the real value of this at all, beyond just being an exercise in sort of academic decision making and sort of laying out a vision for what you would like to do? So are there needs for sectoral laws? Is there an amendment of the Disaster Management Act that's needed? Is there a new law potentially that's needed? So some states have chosen to address this by notifying heat as a disaster, which allows them to access various pools of money. The third is that there was a dire need to carry out targeted and recurring capacity building for actors. So currently, the National Disaster Management Authority has tried to implement this by having 6 monthly consultations with all the state disaster management authority and a large heat wave preparedness conference that happens every year in February, where every SDMA comes and presents their work. There's an opportunity for experts to present and interact with the SDMAs as well and help them refine their work so that they're able to better deliver on this. And lastly, there's the need to build institutional mechanisms for convergence across various sectors. Really, there is no convergence that we speak of. We speak of convergence across all of these areas of work that we do in the development sector. But where the rubber hits the road, there is no such thing. For instance, in most cities, a heat action plan is the domain of a municipality, and a municipality neither has the convening authority nor the ability to drive things across other departments. Even within a municipality, people working on disaster relief don't talk to the people working on health. In fact, one of the pieces of work that my colleagues are engaged in right now is a ground truthing of these apps. So how have these apps actually been implemented over the previous summer season? What are the sort of choke points because of which apps aren't being effectively implemented? How can we strengthen implementation going forward to try and unpack some of these a little further? I'll just dwell on the finance point a little bit to try and explain our next piece of work, which is how do we actually find the finance for various HAP interventions? You can have a laundry list of things that talk about, say, urban greening or creating blue infrastructure or increasing water access or potentially cooling centers and various other things that you would love to do within cities. But how do you actually finance these if you don't have any legal funding or finances to be able to do so? So we try to understand whether there was an opportunity to align solutions for heat action plans with existing centrally sponsored schemes. So there are over 72 schemes that we reviewed as part of this. And the union government allocates a significant proportion of the budget to all of these. We thought, okay, is there a way we can see to align both the goal of the centrally sponsored scheme as well as the goal of the heat action plan so that you can meet both of these at the same time? So we found out from our analysis is that 18 out of the 72 odd schemes that we reviewed contained direct links to various HAP solutions. And 7 out of these 18 schemes unlock 2/3 of all of the money for district solutions. And so effectively what we find through this analysis is that a targeted modification or utilization of funds under a particular centrally sponsored scheme could mean major gains for heat resilience at a local level. So for example, just 3 programs that we can talk about here. Almost every HAP talks about the need for creation of blue-green infrastructure and shelter. Almost every HAP talks about ensuring adequate drinking water supply as well as facilitating urban greening. And if we were to lay out all of these solutions across various buckets and overlay them, this is just 3 out of the 7 schemes that we went in depth into. We see that, say, aligning it with Manrega or with Amrut or with Jal Jeevan Mission means that you have substantial ability to meet dual objectives across both heat as well as social development by aligning the solutions through this framework of heat. From the other perspective, if we were to look at what solutions we have and what are the ways to finance it, we can see that, for instance, for creation of shade, you have no shortage of various center sector schemes that you could potentially use to finance it. So for creation of urban shade, for instance, you could use Amrut funds, you could use funds from the Smart Cities Mission, you could use funds from the Green India Mission. And if it's rural, you could use Campa, Gram Sadak Yojana money or money from the National Afforestation Program. So there's no shortage of money in terms of within the ecosystem to be able to do things effectively. It's just a question of channeling the money effectively through the right lens so that we're able to meet multiple objectives at the same time. So some future directions that we want to lay out with respect to climate and health in India. One is that we've already talked about this to an extent, which is that we need to strengthen governance mechanisms by building state level institutions that A, serve as knowledge hubs, B, facilitate intersectoral coordination, C, align health and development and climate goals, and 4, nest planning and action from local to regional levels. Now, this we have envisioned, my colleagues Navroz and Shibani have written about the fact that an enabling climate law, a law that envisions the bringing together of climate and development, would facilitate the creation of this kind of institution at both the state level as well as union level, and would diffuse climate goals across all of the social programs that we are currently engaged in. Taking this kind of approach would mean that we'd also enshrine it within the legal framework, providing it the right kind of foundation to be able to deliver effectively on its goals. Otherwise, we are essentially relying on the goodwill of other sectors to do things that we need them to do. The second is that we need to really build health solutions platforms with state governments that provide long-term climate projections with a specific focus on vulnerability and vulnerable populations. We don't really have that granular level of data right now to be able to inform this for a variety of reasons, one of which being we still haven't conducted a decadal census to be able to inform us on both population numbers as well as the distribution of vulnerable populations across our various cities and rural areas. We also need to create a map of agroecologically sustainable solutions. There's no point. The heat that you experience in a Bikaner is a very different heat than what you would experience in a Kolkata. You can't have the same set of solutions across the board, regardless of which part of the country you're in. And so it's a question of developing locally relevant solutions. And lastly, we need to identify pathways for financing both in the short term as well as in the long term. The CSS finance pathway that we have identified essentially facilitates part of this, at least in the short to medium term. There are many long-term investments that need to be made that will only pay off in a decade or so, that we really need to find alternative sources of financing to be able to do so. And lastly, where does the health sector is sort of lagging behind really in this conversation? We are at the early stages of talking about climate and health, but really beyond making the moral case for action on climate and health, the health sector has not really been very effective in talking about the how of sort of bringing together health and climate into some kind of unified conversation. This is true as well as in the conversation on air pollution, which is another area where I work, where we have annual conversations about the number of people who are dying from air pollution, and we talk about the need to include health in decision making in every potential avenue, but we don't really have a means of how health could actually make an effective contribution to discourse around these issues. And similar is true here within the climate context as well, where we are largely reliant on making the moral case, and beyond that, we are not really doing much more. And I think there's a way of doing that where we use health as a tool for prioritization of action across different sectors to effectively bring health into the room and have a much more thoughtful conversation on this. And this is essentially the basis of the work that we're trying to do right now, which is how do we bring health-focused policymaking on climate and environment much more centrally. And this is a sort of test case to try and understand that. With that, I'll close for now, and thank you so much for the opportunity to speak to all of you.
Thank you, Bhargav. Very, very lucid, interesting, relevant, and detailed presentation. I think it was really nice the way you were able to use all of the work that SFC and before that CPR have done on heat, the different pieces of work, and be able to illustrate each of the governance related points that you were able to make. I think right from starting off with what the problem is, the need to focus on the vulnerable populations, as well as then looking at broadly what sort of systemic transformations, as you called them, are needed, and how actually there is a lot of synergy in the existing thinking, or in many cases existing policies as well, on social progress and welfare that actually can be leveraged also for action on climate and environment, as well as some things that are still not there, both from the policy perspective and the weaknesses in the existing policies, but also really from all of us in the room, right? The health professionals. I'd like to introduce Dr. Vijay Kumar Chattu and all of the work that he has done to our audience. He is a physician by training, but also now an interdisciplinary researcher for 2 decades with experience in Asia, the Caribbean, and the Americas. He did his MBBS and MD in community medicine from the Mahatma Gandhi Institute of Medical Sciences in Sevagram. His master's in public health from ITM Antwerp in Belgium. His MPhil in global health governance from Stellenbosch and his PhD in international relations, focusing on global health diplomacy and global health security. He currently works as a senior research scientist at Restore Lab at the Demerty Faculty of Medicine at the University of Toronto. And he also holds an adjunct professorship at the School of Public Health, the University of Alberta. Throughout his career, Dr. Chattu has worked with ministries of health, ministries of higher education, international NGOs, multilateral organizations such as the WHO, UNAIDS, World Bank. And as a global health policy advisor, he's also contributed to the T20 policy briefs for the G20 summits and the G7 research groups. Dr. Chattu is one of the top researchers in sustainability at the University of Toronto, and he's also the recipient of the 2023 Adams Sustainability Action Award in the individual faculty category. As a co-lead for governance at the Climate Health Network based at the Ghent University, and as a visiting research fellow at the United Nations University in Belgium, he conducts research on climate change, migration, and health. Nexus with a focus on the small island developing nations. In 2023, Dr. Chattu also started the first ever climate change and global occupational health and safety series in collaboration with CIFAL York University, UNITAR Geneva, and the University of Toronto. He's also a co-PI on multiple projects on UN SDGs for equity, gender, climate change, and health, many of the themes that were introduced to us from an Indian perspective by Bhargav. In October of 2024, very recently, he was also awarded a grant from the University of Toronto for a project on the impacts of climate change on human health and work in the construction and agricultural sectors. He has over 500 research publications and has been consistently ranked among the top 2% of scientists in public health by Stanford University and Elsevier rankings. So looking forward to hearing some of that work from you directly, Dr. Chattu. Over to you.
Good evening, everyone. Thank you very much, Neethi, for this wonderful introduction. And I want to thank Manipal University and especially the director and also Rahul for coordinating this activity for the last few weeks. It's good that at least I think Bhargav has spoken a couple of things which are very important as part of my introductory lecture because certain things like heat and all these disasters, I'm not going in detail, but in my presentation, I'm going to talk more about the global architecture for this climate governance and also how these global partnerships strengthen and also how do we frame health because health is not actually considered as a priority but then we have to from the health public health perspective and also from the interdisciplinary research we've seen that the impacts are more coming on human health and also animal health and how these diplomacies how climate diplomacy and global health diplomacy can play a vital role in that. So I just want to disclose that the grants I'm working on and also the organizations I'm associated with, and and also I work at different places. So I have presented here and I have disclosed all my affiliations, and also I have no conflict of interest to declare. The main objectives of this lecture, as I mentioned, is to give you an overview of this broad terminologies such as climate governance, global health diplomacy, and climate diplomacy, and also to see how these concepts are interrelated and how they enhance the multi-level climate governance at global. So, as we all know that when there is climatic impacts, it can result in hurricanes, wildfires, or ice melting at Antarctica and other glaciers. So, I'm not going in detail about those disasters, but the term which I want to use here is more of climate migration, because according to the IOM, the movement of people basically when they are moving from one country to other country or one state to other state, just because of this impact of climate change, and either they go on a permanent basis or on a temporary basis for some time, uh, or they cross the international border. That is basically, what they term as a climate migration, which is happening very common in the recent 1 or 2 decades. At the same time, there is also another terminology called as climate emergency, which was used to basically as protest against the climate change. And many states, especially even in Europe, they have declared that climate emergency. So declaring climate emergency is an action taken by governments and scientists to acknowledge that humanity is in crisis. So since, if you look at these climate emergencies, since 2016, over 1,900 local governments in 34 countries. So, they have declared climate emergencies as of 2021. So, if we count even from 2021, I think, which some countries have declared already, like Canada and all that. So, it may cross more than 1,900 now. So, on to highlight, I want to say that, in 2019, again, the European Parliament declared a climate emergency. So we can see that basically because of this climate change, it's not just limited to one country or one state or an island, but I think it's more a global phenomenon, and it is impacting not just the human lives but also the agriculture, animal lives, and the whole development as part of that. So. To fulfill the first objective, I think I would like to give a short note about the global climate governance. So, what is climate governance? Basically, it is a continuous process of discussions and negotiations involving diverse group of all the stakeholders, such as the national government, local government, international organizations, and of course the private sector, the NGOs, and the civil society. They want to improve the impacts of this climate change because it's affecting all different directions impact. For example, the way, for example, because of these disasters, whatever development that has happened over the past decades is just gone waste, and it results in scarcity, or malnutrition, or NCDs, or infectious diseases. So we can see a link because of this climate change impacts. We can see an increase in either epidemic diseases or chronic non-communicable diseases in the terms of, let's say, malnutrition and all, or impact of other with the natural disasters that can actually destruct everything. So in basically, if you see this climate governance, as I mentioned, you see it is a multi-level. You have players at the local level, and you have at the state level, regional level, national level, and international level. So, and at the same time, you have sectors coming from academia, or you can have research and industry. You can have other departments such as animal husbandry, human health, social development, agriculture, biodiversity. So in a way, it is a machine network. It's a very complex system here, and there's no gold standard answer or a formula for that. So the only thing what we can do is bring all these stakeholders, bring all these players together, make them understand that we have a common goal and how we can address that. And for that, I think as Bhargav mentioned in his lecture, the most important thing is commitment, the financing, and also we need long-term investments. So for that, actually, we need the diplomacy. So even though it is very multi-level and complex mechanism of in this governance, there are some advantages in that. For example, we can see that there is a collaboration that can happen between these different various departments, or and also it integrates the knowledge, the ideas, and the perspectives that are already there at different levels, coming from the traditional values and the traditional culture, whatever. So we can integrate that with the new knowledge. So it forms a platform so that we can handle these things. And there are other advantages of multi-level climate governance, as you can see in this slide now. It also establishes various objectives, mechanisms, policies, and solutions. And when you are working with different partners and stakeholders, what happens is basically you kind of develop some tools, you kind of develop some structures there is an exchange of information, there is a sharing of values and ideas and decision making. Everyone can participate in that, and at the same time they take responsibility in for doing the follow up and everything. So it enables in a way the collaboration between various stakeholders. So in that way now all the stakeholders can take a role, and they can take a lead role in their own sector, so that they can contribute for the overall impact and also for the development or developing strategies to address these climate change impacts. If we look at this again, this governance is not, now we discuss that it happens at different levels. We know there are many players, but then how does it happen? So it happens through negotiation. So no one is going to give some budget or allocate some funds directly. So we have some gatherings at global level. We have, I mean, they can start from national level or they can go to regional and international level. But at the global level, we have a United Nations Framework Convention on Climate Change. We call short, we normally call it as UNFCCC. So basically, through this, it is like guiding principles so that all countries can contribute and take part in this in their own way in order to address these global challenges. And when you have these global meetings, normally what you have is the side discussions, conferences. You have the bilateral meetings when sometimes the parties, when the countries want to discuss with each other in their bilateral agreements, they can also have this climate change and its impact as part of their agenda. And the action taken, and these once these amendments are made, once these policy documents are prepared, now what happens is they can be taken back to their own country, and they can apply these policies in their national action plans, and it can be part of their agenda. So for that again, we need it means if there is no binding agreement between the countries, no, there is no guarantee that everyone will listen, because these meetings, when you just go and attend at global level, unless there is commitment, the nations or the head of the states may not commit what they have discussed at these global summits. So for that, we have I mean, as UNFCC, which was developed in 1992 during the Earth Summit. After that, we had a Kyoto Protocol. Again, it was developed, all the countries, they took part and they agreed that, we want to reduce the CO2 emission, we want to abide by these targets, we will keep these targets in our countries and to use less carbon and all that. Now, again, after that, we had the Paris Agreement, which happened in 2016. And that's the first agreement where all the leaders, almost like 175 leaders, they signed on that on a single day. So in that way, we can see that kind of commitment from these global leaders or the head of the states to invest in climate and also to improve the climate, to have more climate fund and all that. Apart from that, we also need some technical bodies which give advice, basically. For example, you must have heard of IPCC, which is Intergovernmental Panel on Climate Change. It is not part of UNFCCC, but it consists of technical experts, scientists who work on that and who have vast experience in this and who provides the scientific basis, evidence-based strategies, and they have different working groups, and they give the technical knowledge about the impacts of climate change. So you have the negotiations, you have the legal binding instruments, you have this scientific information coming from there. At the same time, now you have the other stakeholders, as I mentioned, the NGOs, INGOs, and the low civil societies, and all other stakeholders that take part in the movement. Basically, now we see COP29. I think it's going to happen this year in Azerbaijan, and I think they are going to follow up like what happened in Dubai, I mean, last year, and from COP28, what are the take-home messages, whether there have been any implementation, whether the countries have committed to anything or not. So basically, at these global platforms, you have various groups or platforms such as plenaries, informal groups, bilateral meetings. So through these meetings, through these side events, actually, you can promote your agenda. You want to promote health, how the climate change is impacting on health and development. And to make these things happen, actually, now you need a discipline, which is actually either it can be through health diplomacy or it can be through climate diplomacy. So my next part is going to address on how global health diplomacy can enhance or can strengthen the climate governance. So in regards to global health diplomacy, as I mentioned, it is also like a multi-level issue. It has multi-stakeholders, it has multi-actors. The negotiation is happening at multiple levels. So it includes the domains of medicine, public health, international relations, economics, international law, and everything. So global health diplomacy is again a multi-level and multi-stakeholder partnership, and through that, actually, we can address many strategies. For example, we have successfully seen the framework convention of tobacco control, we have seen port of Spain declaration, we have seen pandemic influenza, all these things. When we have, I think, through global health diplomacy, I think even the recent one during COVID, we had the COVAX facility. So this global health diplomacy brings in all these partners at global level. It brings strengthens the partnership. It brings all these multi-level actors to bring together, and for a common goal is to enhance the security, health security. So in that way, global health diplomacy has a very key role in promoting or in tackling climate change. Because what happens is climate change and health are very much interrelated. And when you have any natural disaster or calamity or pandemics due to or epidemics due to climate change and all, it actually, first of all, as part of destruction, there is infrastructure destruction. There is increase in infectious diseases. There is a chance of developing more chronic diseases like malnutrition, lack of food, and all that stuff. Then there's a rise in migration, and which will result actually in which will actually bring in a lot of partnerships, which can't be handled by Ministry of Health itself. You realize that health department is unable to cope up with this unless you have the support from Ministry of Finance, you have needed the support from Ministry of Development, Women and Child Development. So different departments have to come. Only then, the reconstruction or development can happen. So now the role of global health diplomacy is very important because it can bring in all the international agreements, it can bring in all the binding agreements, whatever. Through that, it can work for the commitment for funding, improve the access to care, developing the infrastructure, rebuilding the structures, and everything. So in that way, global health diplomacy can be helpful in negotiating with the partners, establishing the new governance frameworks. It also can be useful to build and manage various donors and stakeholder relations. Apart from that, it responds to this crisis, as I mentioned. So therefore, it contributes, the concept of global health diplomacy can contribute to the peace, security, and human development. Now, I would like to touch this climate diplomacy before I conclude that. So again, in climate diplomacy, there are four pillars. One is to climate diplomacy is also, again, it's a multi-level and multi-stakeholder partnership, and a lot of actions are involved at different local to global levels. So it commits to multilateralism, and it addresses the impact of climate change on improving the peace and security of any nation. At the same time, it also accelerates the domestic action and raising global ambition for the countries. And finally, it enhances or strengthens the international cooperation between countries like Global South, Global North, or through their bilateral or multilateral arrangements. How I can help you or how you can benefit, and there is a transfer of technology, knowledge transfer, and all that. So basically, the climate diplomacy is very important because normally what happens is every country says, oh, I have my sovereignty, or I have my territorial limitations, or I have access to this, and or sometimes the impact can for example, the natural resources like food, water, and energy. If one country is having the most of the benefits and the other country is being impacted by that, or the other country is suffering because of lack of water facility or food, then I think you have the international relations here. You need the bilateral relations, and the country may not agree, but then when we want to achieve the sustainable development goals, when you want to come out of poverty, when you want to come out of, when you want to improve the health, when you want to improve the education and all these facilities, I think, you need a kind of global architecture which actually listens to all the problems of everyone, irrespective of their economic status or development status, to have a fair justification and to give them the resources when they are needed. So I think climate diplomacy and global diplomacy play a significant role here. So some of the milestones in climate diplomacy, if you can see, I think I have listed in the slide. I think. Right from 2008, there was a first EU report on climate change and international security. And as we go in the EU, we have until 2020, we have the Germany, which talks about the climate diplomacy, which takes the agenda in the UN Security Council. So there is a list of all these achievements from 2008, 2011, 15, 18 until 2020. And after that, we see a lot of players in this global climate diplomacy, like, which are the organizations to list. I think, there are so many organizations of UN bodies. Of course, the World Health Organization, United Nations, WTO, WHO, and all that. But apart from that, you have the national governments, you have UNHCR, you have business, industry organizations, civil societies, and of course the professional bodies, associations which are in health, economics, foreign policy. So they all are involved. So it is a multi-stakeholder partnership again, and multi-stakeholder effort in order to promote or in order to frame the importance of health in the wider platform of climate governance. So in the last part, now I think, with this I will be concluding. So I'm trying to see, now we have discussed about climate governance, the main partners and the multi-level. We talked about global health diplomacy, the stakeholders, and we have seen the climate diplomacy, the other the stakeholders in that, and the partnerships, how they strengthen the global partnerships, strengthen the health security. Now we will see how these two domains, like, the climate diplomacy and health diplomacy, can strengthen the health governance, because now we know these two domains are there. There are actions, the negotiations happening at different levels. The most of the global health diplomacy happens at the WHO or between two countries in their embassies, or at national level, in the regional platforms, or like in G7, G20. You can discuss those things. At the same time, even for climate diplomacy also, I think similar platforms are there. So both of these diplomacies are actually preventive, in the sense that there is still a lot, we can, even before the disaster happens, this through this diplomacy is actually, you can plan for them, you can mitigate them, you can invest, you can foresee that, and you can plan now ahead with proper strategies, so that you can promote the stability and development in these countries. So, one of my research papers, I have put this diagram, and I think you can see that in the presentation when it is shared with you. So you have the global health diplomacy in the center, and health is linked with peace, Sustainable Development Goal 6. It is also linked with Sustainable Development Goal 3, and also with Development Goals 10 and 17. But all these are actually in the environment. I mean, the climate change is actually part of Sustainable Development Goal number 13. So what happens is, the health diplomacy is like a steering wheel which connects health, development, and peace and climate change. So you can navigate all these domains through the global health diplomacy. And we also see that global health diplomacy has framed health in many areas, and there's a policy called as health in all policies, which is very important, because again, by doing that, by framing health as very important part of this, you are in fact, you're planning for these challenges and the impact that can happen. So for example, the Sustainable Development Goal 3, it ensure that all healthy lives and promote well-being for all ages. And I think, if you remember in 2021, I want to highlight that a session was held at the 12th European Congress, where, at the Lancet Migration Europe in Regional Health, they focus that accelerating research for climate change influence migration health. So they are worried about, they brought into the picture the role of climate change, the migration, and the health impact. So again, this is a very big nexus here where you can see the impact of climate change on migration, as I mentioned before. So now we can see, and this diplomacy is actually, I can say that, they have played a very critical role. It was successful at different platforms. And it because, there was funding commitment for loss and damage happened as part of COP27. And it also encouraged many public-private partnerships so that, the businesses are also held responsible to address these things. And in this slide, you can see that, how health has been given that importance by, having these high-level committees, which discusses more about the climate change, migration, and health, and also the impact of this nexus for the future. Because most of the times, the global south, which is actually facing the drought conditions or the extreme weather events, mostly you see a migration happening to other countries or to other nations in the global north. So I think, this has been a very prioritized issue. And I think, even in COP26, 27, 28, I think, this is being discussed. And if you see the different, what are the more options or, opportunities for global health diplomacy, I think, it has been, it promoted the value and the importance of climate change at various platforms at WTO, and also it emphasized the role of climate change especially on the small island developing states, because they are the ones which get maximum impact, because they are prone for all these climate disasters on an annual basis every year and with multiple events. So, before I conclude, I want to stress that, there are still a lot of opportunities for global health diplomacy and climate diplomacy, especially in the coming COP29 in Azerbaijan. I think, leaders and also the civil society is raising voice, and many UN institutions and national governments, and especially from global south, I think, they are asking for more dedicated funding, more maintenance in terms of, because if you want to make cars zero carbon or, carbon free, you need a lot of investments in that. And, it doesn't just come by having slogans, but it needs more political and financial commitment, strengthen them. Then only, because again, these are all interlinked with the sustainable development goals. So with this, I would like to conclude with the following statements that the global health diplomacy and climate diplomacy, they bring in all the multiple stakeholders there to contribute in the greater health needs. And also, we need strategies like One Health and everything, because again, these are all interlinked, because by having this One Health strategy, I think, we need not duplicate the actions. We can actually strengthen them and we can align them towards that. And at the end, what happens is, through the nexus between the scientists, policymakers, and civil society, we can actually come up with more evidence-based strategies that can lead for more sustainable development. And I believe that climate diplomacy and global health diplomacy can push the agenda forward in the coming years, in the coming future COP events. And I would like to conclude by saying, stressing the words of our Secretary General at COP27, that the world still needs a giant leap on climate ambition, because it is not a one-time event. It needs a sustainable funding, sustainable models, multilateral partnerships. And if the global south and north is divided, we cannot achieve these. And only through diplomacy, through development, and through these partnerships, we can lead this and work for the sustainable development. With this, I would like to conclude my lecture, and thank you very much for here.
Thank you very much, Dr. Chattu, for laying out the wide arc on the intersecting and really the convergence of global health diplomacy as well as climate diplomacy, and how that's increasingly intersecting, and also actually the nature of the problem itself, which is a wicked problem. As you said, it's multi-level, multi-stakeholder, and really requires all sections of society to come in. Bhargav, you mentioned in your talk about the state being the primary actor, because who has to steward this systemic transformation for climate and health. But We are wondering, of course, what about the other stakeholders? What role then would, the private sector, philanthropists, but also as individuals, in the call, what role do each of these stakeholders have, and how do they sort of, what opportunities do they have to work with the government or collaboratively?
Thanks, Neethi. Important question. And I think when I say that the state has the sort of primary responsibility for steering the language, as we put it, it means laying out the framework essentially within which other actors also have the ability to contribute effectively to facilitate these transformations, right? So, I mean, there is no way you can carry out an energy transition without deeply engaging with the private sector in development of new technology, scaling it up, implementation of the policy, as well as various other aspects from a sectoral lens, right? You can't really address issues of health access or of identifying vulnerable populations or of democratizing the development of local policy without engaging effectively with civil society organizations. So there's definitely space for every different stakeholder to be able to engage effectively with this process, and they all have important roles in delivering the sort of ultimate goals of these various systemic and structural transformations that we have to carry out nationally as well as subnationally. But the framework for that is really facilitated by the state, whether it be at the union level or the state level. If you don't have a framework, you have a patchwork series of actions that are carried out by sector or by the private in a sort of sectoral aspect by various industries, or you have something that is kind of largely uncoordinated and ineffectual, right? And so the idea is that the state holds the bag on all of these things that really need to happen, but the room is there for everybody to be able to effectively engage within that framework.
Yeah, I think important points, and just to also follow up on that, I think a lot of for example, you presented a whole bunch of different, centrally sponsored schemes and existing 3D policies across sectors that potentially have a role in heat, and also maybe in other climate programs similarly. But really, have the effectiveness of these existing policies been assessed from sort of a climate and health perspective, but also from a vulnerability perspective? Do they help address, and whose role is that? I mean, is it the health sector's role to be able to assess that, or is it, or can we leverage some of these other stakeholders?
So let me break that into two parts, right? Are these policies being effectively implemented is one part, and the second part is whose responsibility is it to try and unpack the different layers that are necessary to try and effectively implement this. So are they being effectively implemented right now? My guess would be in some cases, yes, in a limited sense. In most cases, probably no. Because the analysis of HAPs that I showed, there is largely sort of cookie cutter solutions across each one of these, right? So every city has some form of, we need to increase green cover, we need to increase sort of urban blue infrastructure, we need to create cooling centers, we need to create this, that, and the other. And largely a lot of their solutions are focused on the here and now. So how do you respond to heat waves? Not necessarily heat that you're going to be facing 15, 20, 30 years from now. And aligned with that is sort of a set of actions which are limited in the sense that during a heat wave, it's issuing public information, alerts, readying the health system to be prepared for potential for heat-related illnesses. And that's the extent of action during heat waves for the most part. There may be a few cities, for instance, which have a legacy of work on heat, like say in Ahmedabad or other parts of the country where there is slightly more coordinated response by the municipality, but that doesn't really exist elsewhere around the country right now. The second part of who's responsible for identifying issues of vulnerability, vulnerable populations, targeting an effective response to this, there are so many people responsible that's what makes it a challenge, right? I think the first aspect is that identifying vulnerable populations requires the kind of granular demographic data that only comes from an enumeration process. And we haven't done an enumeration in over a decade now. I mean, without an effective census, you don't even know how many people live in every part of the country, in every ward, every city, every block. That allows you to effectively then understand, okay, within this block, who is vulnerable, who needs to be catered to most effectively. You need to layer that then with GIS data that identifies urban heat islands and hotspots. Where do you need to increase green cover? Where do you need to increase access to water? And then you need to build that into some kind of effective policy response. So there's lots of different actors that need to contribute to this. The health system, of course, provision of effective primary healthcare services in urban areas is a sort of long challenge that India has been dealing with, and really not much has happened with the National Urban Health Mission. But at least from the perspective of mitigating the impact of heat on cities, the health system's focus is primarily on response right now. The question of gathering data, I think that's one of the questions that was asked in the chat by Dr. Kapil. And I've answered that, so people can refer to that if they like. But the health system is falling down on the one aspect where it can help, which is the generation of effective and useful data to try and unpack some of these issues.
Thank you. Dr. Chattu, Bhargav is talking about all of the challenges with just, individual policies within one country. You, of course, laid out all of the, global forums and the opportunities at the global level. And I'm wondering, really, given the geopolitics currently, I mean, the divided world, given the fact that there are so many competing priorities, how optimistic are we that, in fact, this convergence will occur in a way that's actually going to contribute to meaningful action on climate and health at the global stage?
Yeah. I think I echo with Bhargav in terms of the role of state, especially because it has to form the policies and everything. Because, yeah, I think there is some echo, or is it okay? Someone is, yeah.
Can we request everybody else to kindly mute their mics?
Yeah. So I think, definitely in terms of international relations, state is the most powerful body entity in as such, because no one can force a state, because it has its own sovereignty, it has its own rules and regulations and everything. But when it comes for a common good, for example, a global issue like climate change, I think definitely it has to be more responsible. But when it comes to climate change, I think everybody is aware that when all these COPs happen, it's mostly the civil society actually that is really fighting for on the roads, coming on streets, the campaigns. If you remember, Greta Thunberg from Sweden, that Swedish girl, I think, she is a very big climate change campaigner. And, last few years, we have seen how she has traveled different countries and claiming for, like to save the climate and all. So what I mean to say here is that the civil society is so much empowered. And I think, there's a lot of pressure on the governments to enact these things, because even though if the country as a state is negligent or not, or thinking or taking a back step, I think the civil society, the NGOs, I think that movement is very big, and in a way there's a kind of pressure on the states. Secondly, I would say the problem comes here between developed and developing countries. When it comes to climate change, there's always a complaint from developed countries, because what they say, China is burning this much coal, or it is, or India is producing this much and all. But if you look at the per capita consumption of CO2, I think, emissions, per CO2 emissions, you see all these developed countries like, the Middle Eastern countries, Saudi Arabia, Qatar, UAE, US, Canada, they are the largest producers of CO2 per capita in terms, if you look at. But if you see as a whole, the country contribution, then again, you have the developing countries which don't have that much infrastructure to be carbon free right now. So I think, it is a matter of, that is where, we need negotiation. That is where, if a developed country wants everyone to follow zero emission and all, they need some funding to support, because there are many other priority issues in the government. People are dying because of lack of food, lack of health facilities in many developing and underdeveloped countries. And if you talk to them about these new, electrical vehicles and all that, zero carbon, it doesn't make sense for them. So that is where, you need this kind of, climate diplomacy and global health diplomacy, which makes everyone understand that, ultimately this is going to affect everyone on the globe. And okay, right now you are in a different stage of development. So I think, we can help you in this. We can provide you some subsidies, or, we will fund you on this to construct this or to develop these strategies. So that way, what happens is, through this public, private and business involvement, you can pool some funds, some dedicated funds for those needy countries. And that is where actually the COP, every time there is a fight here only because the developed countries are unable to dedicate that much requested funds. Whereas, they have high expectations from the developing countries that they should stop this, they should stop that. So I think, we need to reach a balance which is justifiable, which is, fair enough. And I think, but we don't have much time. The problem is we are already having the impacts of the damage caused. So I think again I would come back to diplomacy and negotiations. That's the only answer for that. Yeah.
Thank you. But I would like to push you a little bit, and maybe I'll frame it slightly differently. If I may ask you to just, reflect on one big opportunity that you see within, the global climate and health diplomacy, and also one big challenge, the top opportunity and the top challenge for, getting stuff done. What might you
I think,
right?
right now, you see, climate change, migration, health nexus, what I mentioned, that is the biggest task right now, the migration that is happening and the impacts of climate change that are happening. And, it is not just when we say health, it's not just physical health, but, it is a generational because, when you migrate, it is a lot of, not only physical health damage, but also mental health. Now, mental health has become a very big challenge because we don't have that much support to provide the mental health services in any country in that way because the burden is so high, rising, and most of the time it is undiagnosed. And you have people coming from different geographical setups and also different cultural setups. And now when they move to different places, again, the host country has challenges and the new people have to adjust. So I think, this is a vast phenomenon. And, many countries have started their nationalist agenda saying that, no, we want only our people. We don't want any newcomers. And so, with the kind of, hegemony of any one particular country going off, now we have multipolarity and countries are getting divided in the different interests basically. So we have different alignments and the groups which were before are not the same. So I think at the end who is getting impacted by this is, like as Bhargav mentioned, the vulnerable people, the people who don't have any facilities, who are poor, or who don't have access, who are suffering the inequalities and iniquities. So I think this nexus itself is the biggest challenge for the next future decades.
Thank you. I think in the interest of time, I'm just going to open it up to the audience. If anybody has a question. Thank you, Bhargav, firstly, for answering in the chat. But if there are any burning questions, unanswered questions that anybody would like to come in with, please unmute your mic and raise your question.
Yes, ma'am. I don't think there are much questions, ma'am, except for those have been texted or chatted, ma'am.
Sure. In that case, I have one question to both of you, to both our panelists, actually. So you both actually introduced a lot of complexity. I mean, you both made the point about how different sectors are involved. Whether in Bhargav talked about schemes from other sectors, non-health sectors as well who are involved, and how, everybody needs to work together for a whole of society approach. And Dr. Chattu then took it to the next level and said, okay, actually, we need to integrate all of these different, global health and climate diplomacy opportunities and get all of the countries to work together. So there's a great deal of complexity. And I know that this is an audience of, a lot of students are listening in today, since the event is being hosted by the Prasanna School of Public Health. So on behalf of all of the young, the young professionals who are just coming up, what kind of, if you have some reflections and thoughts on how emerging health professionals need to train themselves to be able to address this level of complexity, how the training needs to shift, our public health training, what kind of skill sets are required for those who are coming into the, to the job market or to begin to work on some of these issues, would you think? Maybe first, Bhargav, from an Indian perspective, and then over to you, Dr. Chattu, after that, to look at it more globally. Bhargav.
Thanks, Neethi. Really complex question. I don't know if we have time to get into all of it, but just sort of high-level thoughts, right? I think having worked in environmental health for a little over a decade here, I think I can clearly say that the capacity really isn't there even now to be able to effectively answer all the questions that we have. There are no shortage of burning questions that we need answers to, and the research capacity isn't there. Neither is the implementation capacity there from an environmental health perspective. And I think the next generation of public health graduates can really help inform a lot of these questions. Both through the lens of, I mean, there's no shortage of skills that you can apply to questions like this, right? I mean, the intersectionalities associated with how climate impacts health, as well as livelihoods, as well as various other developmental paradigms, means that you need a variety of different approaches to try and answer a lot of these questions, whether they be deep data science skills to analyze large data sets to help understand and identify vulnerable populations, or qualitative skills and ethnographies to be able to unpack the stories of people, lived experiences, to try and then help inform localized policy making. So whatever way you want to approach this question, there's always something interesting that you can do, and there's some kind of impact that you can have. So I'm a little bit more optimistic that more people will sort of come into this space because it is sorely lacking in the capacity to be able to effectively do the work that we need to.
Dr. Chattu?
Yeah, I would say that I think, from my experience, what I see when I teach different students and all, what I feel is that, everyone is very much narrowly focused. Oh, this is my subject, this is my area, right? What happens is when with that narrow thinking or that silos approach, what happens, you miss a lot of things. Some of them you may be knowing. So I would say for any student in public health, in medicine, or in social sciences, I think they need to have this kind of interdisciplinary knowledge and approach. They can take some short, micro credentials, small courses such on interdisciplinary areas like planetary health, One Health, climate change. So this kind of, this gives them a perspective, broaden their thinking and ideas, how they can actually contribute, how they can be valued as a professional once they start working. And most of the times, you can find the solution so easy because sometimes when you talk with the other person, when during the discussion itself, actually, you have a solution or you have some idea. And I would also say that, when the research work also, I would say, when you're writing a paper or when you're doing a proposal for something on this topic like climate change, which is having a lot of domains, you need to talk with different people, you need to engage with different stakeholders, work with the industry partners, and, bringing work with Global South, Global North, by having that kind of exposure, I think, this is all, you don't get that from the textbooks. You just get from interactions, you get from discussions from others and all that. So I think, this is very important. And I think, we can't delay because the knowledge, at this stage, I think, climate change is going to be a big problem. And this is going to be a topic, and it intersects with everything we talk in any discipline now, because it has impact on development, gender, partnerships, all these things are there, right? So I think I would say, to promote the interdisciplinary knowledge and have that kind of approach to learn with a wider idea.
Thank you very much. I see we're at time. There are several questions in the chat box. I know Bhargav has been asking or answering some of these. If there are any other questions, feel free to sort of put them. I know the Manipal team is collecting them, and we'll find a way to actually come back to you with answers. Beyond that, I think a recording of this today's event is going to be put up in a few days. So hopefully, if there are any further, thoughts that any of the participants have, I'm sure there'll be opportunities to reach out to the speakers today, but also maybe other experts on several of these issues. And as Dr. Chattu said, we need to continue this conversation and broaden this really and bring in as many different people as possible. Thank you very much. Good night. Bye-bye.
Thank you all.
Thank you so much.
Thank you all. Thank you so much. Thank you, Dr. Neethi Rao, ma'am. Thank you, Dr. Vijay Kumar Chattu. Thank you, Bhargav. Have a great evening.
Thank you. Bye-bye.